Hi, it's Dr. Kirby. When we were in clinic, we had spoken about doing a procedure where we're going to learn more about your back. What we'd like to do is take a few minutes to explain everything about what we're going to do with this procedure and answer any of the common questions you may have.
Hi, my name is Samuel, and I'm part of Dr. Kirby's care team. So it seems that your care team is determined that the next step in managing your pain is a medial branch block injection. Before we begin, it is important to know that this injection is going to be temporary with the aim of helping us figure out where the pain is coming from. This injection may give temporary relief, but the main purpose of this injection is to make sure that the pain is really coming from small nerves that are in your back called the medial branch nerves. The results from this procedure would guide us into determining whether a radiofrequency ablation is the next step. Also, it may take us in a different direction that may be more effective.
Hello, I'm Sonia Riley, Dr. Kirby's nurse practitioner. I'm excited to explain the procedure to you that we will probably discuss in an office visit. What is a medial branch block? So it's an interesting injection that Dr. Kirby will perform once you're at the surgery center. We will go in around the joints in your back called the facet joints. There's also another name for the joints, but it's really long. So we commonly call them just facets. He will go in with sterile procedure and put numbing medicine on the joints that we have discussed in the office. In this procedure, he will walk you through exactly what needs to be done. You will not receive any IV pain medicine because the procedure itself is what we are looking for to find out if this is where your pain is coming from. The medication is simply just numbing medicine, and it's very well tolerated. Some people are a little bit more sensitive than others, but you're going to do great. Why is this block done? We use this block to help determine, is this where your pain is coming from? As you know, low back pain or even neck pain is very difficult to help us diagnose which direction to walk in. So the block is done to perform a diagnostic test, and it's a test only. So this medication is short acting and will usually wear off anywhere from 12 to 24 hours. There will be a series of blocks performed if the first injection is successful. After you called in your pain diary, we will determine what is the next step. Do we continue on with the second block? Most all insurances require 2 blocks before we get to the final procedure called the radiofrequency ablation, fancy known as the nerve burn.
Hi, my name is Amanda, and I'm Dr. Kirby's primary nurse, and I will be the one scheduling your procedure. Now that you've decided to move forward with the medial branch block, we will now set you up for the procedure. This will be done at the West Georgia Surgery Center. Next, you will be receiving a text message with your procedure date. It will also include the pre-procedure instructions in a PDF format. Please make sure you view these. If you have any questions, let me know. The procedure will be done down at the West Georgia Surgery Center. This will also include the phone number and the address for the surgery center. Your instructions will include that you may eat or drink before the procedure. You must have a driver. For the lumbar medial branch block, you will not have to stop any medications. For the cervical medial branch block, there is a list of medications that are blood thinners that you will need to stop. This does not include aspirin. Once you arrive for your procedure, you will be taken back into the triage area and your vitals will be checked. Then you will be escorted into the room where you will be cleaned and prepped using sterile technique. Then Dr. Kirby will walk you through the procedure. Afterwards, you will receive a pain diary. You will fill this out for the next 12 hours. The pain diary is very important. Please make sure that you fill it out. There is a phone number at the bottom that you will take a picture of the pain diary and send it to that number.
I'm Kimberly Hook. I'm part of the Kirby Clinic here at Ortho West, and we're going to talk about what's next, medial branch blocks. So you've had your procedure done, and you're going to go home with your pain diary. Make sure you resume all normal activities for the day. We don't want you going home resting. We want you doing all of the different activities that would normally cause you discomfort. So if mowing the yard hurts your back, try it. We want to know if you're getting relief. Document this on your pain diary and send it in to us to let us know. Regardless of whether or not you get relief or you don't get relief, we're going to know which direction we need to move forward with your care. Should you get relief from your first medial branch block and you send us that pain diary in with your results, we will go ahead and schedule you for the second medial branch block. However, if you are one of our patients that does not receive relief from the first medial branch block, do not be discouraged. We will schedule you for a follow-up visit with our clinic, and we will discuss other procedural options. Either way, both help us move forward with your care.
Thank you so much for listening to this video. I know that when we're in clinic talking about this, it can be a lot all at once. So please feel free to listen to this as many times as you need. Show it to your family, and even send us back any questions that you may have. We really just want you to do better. I think when you understand what it is we're trying to accomplish, we're just more likely to have success. When you know the kind of information that we need to draw out of this procedure, it really makes the procedure more useful. And so thank you for helping us do that. Thank you for choosing us, and we look forward to seeing you on the procedure day.